So imagine that you get a call, you get a request to come and provide some additional physician support at a small, rural, critical access hospital. There's a new CEO who has joined this hospital. They've had trouble recruiting, retaining physicians. This hospital does not have a good reputation with the community, medical community, or the local community. They need physicians clinically and to fill some administrative roles. They've struggled for many, many years. They don't have much to offer in the way of compensation, and some of these roles will be volunteer. What would you do if you got that offer? I'd say go for it. And that's what I did. This has opportunity written all over it. My name is Heather Davis. I'm the hospitalist medical director, the chief medical officer, and the volunteer chief of staff for Pender Memorial Hospital. In full disclosure, as chief of staff, I sit on the board of both Pender Memorial Hospital, which is this critical access hospital, and New Hanover Regional Medical Center. Just a quick background, Critical Access Hospital is a designation that was put in place really to help with hospitals that are serving in underserved rural areas. You have to meet some criteria, distance being 35 miles from a nearest hospital or 15 miles if it's a mountainous area. Your average length of stay needs to be less than 96 hours. You need to provide 24/7 emergency room coverage. And with that designation, you're licensed to operate up to 25 beds. These can be acute beds or what we call swing beds. They can be skilled nursing, they can be acute, they could swing either way, but up to 25 beds to provide these services to your community. And the benefit you get by having this designation is that you get a higher rate of reimbursement. So that helps for, again, many rural areas and critical access hospitals that have trouble with being very financially vulnerable. So again, most critical access hospitals, as with any rural areas, the emergency room is one of the main providers of care. Access to care is one of the biggest struggles in a rural area. So emergency rooms in these areas serve the purpose of primary care, urgent care, and emergent care. And so there is this opportunity for how to utilize these hospitals, how to utilize it both inpatient services, outpatient services, and again, to use this valuable resource in these rural areas. So Pender Hospital faces the typical challenges of many critical access hospitals. Again, recruiting and retaining physicians. Oftentimes there tends to be an ER physician and one hospitalist, very isolated, working independently, no real specialist support. The patient population tends to be older, a lot more chronic disease, poorer patients, very low volumes. So you don't get the opportunity to see a wide variety and get very comfortable with many different disease processes. The payer mix tends to be Medicaid, Medicare, or lack of insurance. And there's very limited services that are offered at many of these hospitals, and the training of the staff, any of the staff, is very limited. One of the unique things about Pender Hospital, again, has a very poor reputation and perception when I first came on there. And so that's not typical of all critical access hospitals, but in this case, that was what I found when I first came there to serve as a hospitalist. It was lacking engagement for many staff, lacking leadership. People worked in silos. I don't know who the leadership was. People worked behind closed doors. And all of these things led to underutilization. People bypassed Pender Hospital to go to our regional tertiary care center, New Hanover Regional Medical Center. The unique thing is that we actually had a relationship. We're part of a health system with New Hanover Regional Medical Center, and they financially support us and manage us. But these were all things that we were not taking advantage of. And so this is where the opportunity was. There were steps that could be taken and doors that were open to be able to collaborate and utilize this relationship and this health system that with New Hanover Regional Medical Center being this high quality, highly reputable organization, and how we could connect with that. But again, we had to take steps, and we had to go through those doors, get up to those doors that, yes, they were open, but why weren't we doing that? This is why. The trouble with opportunity, it comes disguised as hard work. Whether it's people just frankly didn't want to do the hard work, or there was no leadership to support that. But we knew there was a tremendous amount of opportunity. There was going to be tremendous hard work to be done. And really, we needed to change the culture of this hospital, the culture of this organization at Pender Hospital. And with the introduction of this new CEO, again, is when I raised my hand, I leaned in, and I said, let's take advantage of this opportunity. Let's work together. We both had a shared vision of what we wanted to do here. We built relationships among our administration, among our managers, and we really developed leaders. And over time, we built trust among everybody. And we did this over and over and over again. Regardless of what the projects were, we went off in many different directions, looking at ways we can improve quality and safety of care, because that was really the foundation. We couldn't do anything without doing that. We couldn't utilize this valuable resource without doing that. And so over the next couple of years, we developed our clinical leaders. We built those relationships. We collaborated with New Hanover Regional Medical Center. We challenged ourselves to educate and elevate. We raised that bar. And we really leveraged those relationships. That there was opportunity there, but this was the hard part. We really didn't have any credibility. We really weren't worthy. We really didn't have respect within our system. And so we needed to lean in and raise our hand and sit at those tables over and over and over again with our counterparts, with our board members, with our system leadership, and develop relationships to be able to utilize all of these excellent quality and safety projects that were happening at New Hanover Regional Medical Center and bring them to Pender Hospital. And one of the most important things, as we did that, we shared the results of these quality improvements and improving the safety of our hospital, and we celebrated them throughout all of our organization, internally and externally. And then while improving this quality and safety, our next step was really to take that foundation and embark on new strategic initiatives with new services offering at our hospital. This picture is our interdisciplinary grand rounds. This is one of the initiatives that we took to improve quality and safety. On the far left, one of our recent residency graduates. This was another way we developed a rural track rotation for residents to come up and actually see what we were doing and spark an interest and help recruit these physicians. And this is one of our recent residency grads that joined us. And then all of our other clinical staff. This, again, everybody, instead of working in silos, they became engaged, they became accountable for the care they're providing to our patients, but they also became part of a team. And so as that team, they had that support, and this is when we started to see this culture shift. This was a DEA opioid take-back day, again, a huge crisis in our community and many. This was something that was happening at New Hanover Regional Medical Center, but we hadn't really collaborated with them. And so here we took the opportunity to say, how can we do this not just in New Hanover County, but in Pender County, and show our community that we are also, outside of the hospital, we are committed to improving the safety of this population and this community. And one thing I want to point out, we have New Hanover t-shirts and we have Pender t-shirts. I don't know if when I started we even had anything with our logo on it. Certainly nobody probably would have worn it because there wasn't much pride, there wasn't a culture there to support it. Now when I've worn those things, I've had people come up and say, do you work there? My mom stayed at that hospital. She got excellent care. We love that little hospital. And so now I'll wear a branded t-shirt, coffee mug, umbrella. I'll wear them all at the same time because I'm so proud of what we're doing. Several other patient safety and quality programs. We developed an antibiotic stewardship program. It was recognized by the CDC as a leading example of how to design and implement an antibiotic stewardship program for a critical access hospital specifically. We were able to do this by, again, sitting at the table and collaborating with our infectious disease specialists, with our microbiologists, things that we don't have at Pender Hospital, but we had at New Hanover Regional Medical Center, and they had implemented. And so we could apply this, and again, was recognized by the CDC as a leading example. We've had multiple leaders of excellence, staff and employees of excellence that have come out of Pender Hospital, again, all signifying that culture change that we needed to see in that foundation. And again, another picture of just that collaboration of all of our clinical care teams. On the far left is one of the awards that we've received, Working as a System, one of our lab leaders. Again, this was every single department at this point has been recognized for their contributions to quality and safety at this hospital. We've received awards both locally, statewide, regionally, nationally, and for clinical, both clinical and administrative improvements. And really, again, back to not just that we've done this hard work, we've taken these steps and pursued these opportunities, but that we've shared them and we've celebrated them. And that has developed tremendous pride among the people that are working at our hospital. And it doesn't really matter whether it's an award. We'll find anything to celebrate, honestly. And so the other picture was the day of the eclipse. Bought some glasses, got black and white cookies. It was an opportunity to just take a break from the hard work that everybody was doing, and 5 minutes, have plan ops, have dietary services, have physicians, have nurses, just come together and spend some time together. Take that moment to have fun and celebrate, and again, drive that culture. It really led to this point. Again, we did all these quality and safety improvements, but how are we going to utilize this hospital and this valuable resource? And so it's myself and to my left, my chief nurse, and she was instrumental in engaging and raising the bar of clinical quality throughout all of our departments. And once we had this foundation, we said, how are we going to utilize this? And we identified a need with the cardiothoracic surgery department at New Hanover. They're high utilizers, they're post-surgical patients of post-acute care and skilled nursing. And so we came to them, we said, we want to build a relationship with you. We have something to offer. Tell us your needs, tell us your challenges. And so we worked together, we went back to those same methods of building relationships, of finding that shared vision, of building trust together. And over this last year, we've been on a pilot project with them to really improve their patient care, their patient outcomes. We've raised our hand, we've sat at their table, we've gone to their 6 a.m. surgical meetings, and we've shared feedback, and we've continued to improve this to the point that we've reduced their readmissions, we've reduced their lengths of stay. We have gotten feedback from them that their patients and patient families coming for post-op appointments have been overwhelmingly positive about the care that they've received. And so much so that we've become their preferred post-acute care site. It's not appropriate for everyone to come to Pender Hospital. It's not the place that is nearby to everyone's homes and their friends and their families. And so what they've actually challenged us to do is say, this has become our leading example of how to take care of these patients. And we have been asked to spread that word and become the teachers and basically share this pilot program with all these other critical access hospitals and skilled care facilities that are in our region. So we went from this place of no credibility, not being worthy, not much respect, to being the leaders of this post-acute care and skilled nursing. And again, not just improving it for our community, but now being able to have a much greater impact in our entire region. So next to Cindy is the coordinator for our surgical care, cardiac surgical care, and he and his team are really the ones who have helped us to implement this. But he's also been a voice for us to the future of now that we have this pilot program, why can't we take that and apply it to any post-surgical patient? And so the next person is Kimberly Dugan, who's part of our surgical home and a new surgical navigation center. This addresses patient care needs from pre to post-op. And again, we've really raised our hand, said we'd like to sit at your table and we'd like to implement this program and help to improve the care of any post-surgical patient. So that's really kind of where that's taken us. It's the next thing on the horizon. This is a picture of our team. This has taken every one of our managers, our leaders, to lean in, to again show up and raise their hand, to sit at these tables and work with their counterparts, bringing these quality and safety initiatives back to Pender Hospital. They're an incredible team of people that I'm honored to work with every day. We actually had somebody come and visit our entire system recently. And the one thing that they came away saying specifically about Pender Hospital is that our culture is impressively strong, and our people are enthusiastically proud. That's the reward that we have. That's the culture that we have at this hospital. That's been an incredible journey to be on with them. And so what I would say is when you get that offer, it might not be the corner office. It might not be the highest salary. It might not be the dream job of your choice. But if it's something you believe in, if it's something you think is worth it, if it's something you think will change people's lives, go for it. Take the chance. I bet it'll be the most rewarding experience that you ever have. This is where I started my journey, and this is where I continue my journey, is with our CEO of Pender Hospital, Ruth Glazer. She's been an incredible mentor and leader. And times when I have not had the confidence to lean in, times when I didn't feel like I was meant to be at a table, it's all of her advocacy and support that have helped me and given me that courage to keep going and to continue to build and have this incredibly rewarding journey. So thank you to the Leadership College and to my fellow classmates for this opportunity.